Hello everybody, welcome back to my channel. So in this video I'm gonna be making a video on COVID-19 coronavirus. It's called the novel coronavirus. So what is coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the normal cold to more severe diseases such as Middle East Respiratory Syndrome and SARS, Severe Acute Respiratory Syndrome, which was found in 2012, Saudi Arabia. The most recent discovered coronavirus causes coronavirus disease COVID-19. It's called novel coronavirus. What is COVID-19? COVID-19 is the infectious disease caused by the most recently discovered coronavirus. This new virus and disease were unknown before the outbreak began in Wuhan, China in December 2019. Here's what we actually know about the novel coronavirus. In December 2019, a cluster of pneumonia cases in China. Investigations found that it was caused by previously unknown virus, now named the novel coronavirus. Coronaviruses are a large group of viruses. They consist of genetic material surrounded by an envelope with protein spikes. This gives it the crown appearance, hence named coronavirus. There are different types of coronavirus which cause respiratory and sometimes gastrointestinal symptoms. Respiratory diseases can range from common colds to pneumonia. What are the symptoms of COVID-19? The most common symptoms of COVID-19 are fever, tiredness, and dry cough. Some patients may even have aches, pains, nasal congestion, runny nose, sore throat, or diarrhea. What can I do to protect myself and prevent the spread of the disease? Stay aware of the latest information on the COVID-19 outbreak available on the WHO World Health Organization website and through your national and local public health authority. You can reduce the chances of being infected or spreading COVID-19 by taking some simple precautions. Regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water. Maintain at least 1 meter, which is around 3 feet, distance between yourself and anyone who is coughing or sneezing. Avoid touching eyes, nose, and mouth. Make sure you and the people around you follow good respiratory hygiene. This means covering your mouth, nose with your bent elbow or tissue when you cough or sneeze. Dispose of the used tissue immediately. Stay home if you feel unwell. If you have a fever, cough, or difficulty breathing, seek medical attention and call in advance. Follow the directions of your local health authority. Stay informed on the latest developments about COVID-19. Follow advice given by your healthcare provider, your national and local public health authority, or employer on how to protect yourself from COVID-19. Keep up to date on the latest COVID-19 hotspots. If possible, avoid traveling to places, especially if you're an older person having diabetes, heart, or lung disease. So in this picture, it actually shows you what you need to do. It says wash your hands for 20 seconds. Use a tissue when you cough or sneeze. Avoid touching your face, your eyes, your nose, and your mouth. So, how likely am I to catch COVID-19? The risk actually depends on where you are, and more specifically, whether there's a COVID-19 outbreak unfolding there, like in Syria or Arabia, is there a COVID-19 outbreak? For most people in the most locations, the risk of catching COVID-19 is still low. However, there are now places in the world where the disease is spreading. For people living or visiting these areas, have the risk of catching COVID-19. Should I worry about COVID-19? Illness due to COVID-19 infection is generally mild, especially for children and young adults. However, it can cause serious illness. About 1 in every 5 people who catch it need hospital care. It is therefore quite normal for people to worry about how COVID-19 outbreak will affect them and their loved ones. Are antibiotics are effective in preventing COVID-19? No. Antibiotics do not work against viruses. They only work on bacterial infections. COVID-19 is caused by virus, so antibiotics do not work. Antibiotics should not be used as means of prevention or treatment of COVID-19. Is there a vaccine or drug? Not yet, today. There is no vaccine, no specific antiviral medicine to prevent or treat COVID-19. However, those affected should receive care to relieve symptoms. people with serious illness should be hospitalized. Most patients recover thanks to supportive care. Should I wear a mask to protect myself? Only wear a mask if you are ill with COVID-19 symptoms or looking after someone who may have COVID-19. Disposable face mask can only be used once. If you are not ill or looking after someone who is ill, there is a worldwide shortage of masks. So WHO urges people to use masks widely. Can humans become infected with COVID-19 from an animal source? Coronaviruses are a large family of viruses that are common in animals. Occasionally, people get infected with these viruses, which may then spread to other people. For example, SARS coronavirus was associated with civet cats and MERS, and coronavirus is transmitted by camels. Possible animal sources of COVID-19 have not yet been confirmed. How long does the virus survive on surfaces? It is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Studies suggest that coronavirus may persist on surfaces for a few hours up to several days. This may vary under different conditions like temperature, humidity, or the environment or the place, or like what thing it is. Is it safe to receive a package from the area COVID-19 has been reported? Yes. The likelihood of an infected person contaminating commercial goods is very low, and the risk of catching coronavirus that causes COVID-19 from a package that has been moved, traveled, or exposed to different conditions and temperature is also low. Is there anything I should not do? The following measures are not effective against COVID-19 and are harmful: smoking, taking traditional herbal medicines, wearing multiple masks, taking self-medication such as antibiotics. In any case, if you have fever, cough, or difficulty in breathing, seek medical care early to reduce the risk of developing more severe infection, and be sure to share your recent travel history with your personal healthcare provider. So thank you all for watching.